Hi, good afternoon, everyone. Thank you for joining our webinar today. I hope that you are each staying well and safe. Looks like we have a full house here. This is exciting. We're so grateful to have Dr. Ruth Carrico from the U of L Department of Medicine, Division of Infectious Disease with us this afternoon. We spoke with Dr. Carrico about a month ago, and we're so thankful that she's sharing her time with us today as a follow-up from that discussion. A lot has happened in the past month, and we're interested to know the latest from her perspective, as well as some recommendations that she and her team suggest as businesses begin to reopen over the next couple of weeks. Also want to just update you on a couple of things regarding GLI activities as it relates to COVID-19. We have formed a renewal task force, as many of you may have read. It is chaired by Carrie Stemler. That is a group of 70 individuals who are getting together on a regular basis to talk about ways that we can assist the business community through this crisis. They have broken into two groups. One is focused on advocacy and education. That group is really trying to help shape the next federal relief package and help educate businesses on what is out there, what people can apply for. And then also there is a group that is focused on reopening recommendations. We did submit feedback to both governors, and the conversation just continues, because the more that we learn, the more that we're able to then help educate businesses on some of those technical components, sharing best practices about what can be done to have a safer reopening. So after Dr. Carrico speaks with us, we will be taking questions in the chat box. You'll see that at the bottom of your screen. I'm sure that we're all very familiar with Zoom by now, but we will try to go through all of your questions and get through them all. Our team will be sending them as you submit them in the chat box. We're also recording this webinar, and you can check back on greaterlouisville.com for a recording of it if you have to hop off early as well. And you will receive an event survey after this is concluded. With that, I'd like to welcome Dr. Carrico.
Thank you. Thank you so much. I'm going to see if I can switch my screen here. Hopefully you'll be able to see this. Let me know. Sarah, can you see the slides okay? Perfect. All right. So I know that there is a lot of information that is available that's just coming to you, great guns, regarding the reopening of our community. And I, for one, have to say I'm certainly glad to see this, although I know that it is not going to be without a challenge. But it has been a time like this that we have seen both the benefits of having the city, the community, much more cautious and spending time at home. But at the same time, we have seen a number of issues that are equally as problematic as they are beneficial. So many of you have seen not only the economic issues and are experiencing that yourselves, but people are social animals, and it's very difficult to be away from each other. And then we have a number of issues, everything from mental health issues to coping issues to child abuse, intimate partner violence, and so forth. So getting our community kind of back into a closer sense of normal, I think, is beneficial for everyone. Now, having said that, we're going to have to be on guard, and we're going to have to be watching what this means to not only our businesses, but to our community. So I thought today I would focus on the workforce and looking at what the impact of COVID-19 is on your workers. And then what do we do with respect to recognizing disease? Where do we stand with some of the testing? And what are some of the issues that we are concerned about regarding this hailstorm of immunity tests, I think, that are available? And I want to try to really focus on the risks of those types of tests and using them then to make some of your business decisions. So let me hop right in here. And I want to talk a little bit about how we identify disease, and then look at some of the risks, benefits, and limitations of what we do for testing. And I'm going to try to do this with some scenarios. So I want to start off with just some basic information that as a business community, we need to be aware of and thinking about with our employees. And I think first and foremost, we need to make sure that all our employees know what to do if they become sick. They also need to know what happens if someone in their family or their roommate becomes sick, because that may impact their health and perhaps their willingness or ability to come to work. Make sure the employees know how to share information about their illness and that they feel secure in doing so. So we want people to be able to tell us the truth about what is happening with them, so we can figure out what it means then to everybody's safety at work. We need to know and share with them what symptoms we need to be particularly attentive for. Now, this in and of itself is a challenge, because I'm sure that everybody is reading more and learning more about this virus than you ever wanted to know. But we know one of the problems is that we have individuals who can be without symptom, yet able to transmit. So they can be without symptoms, yet infectious. We know in a lot of viral illnesses, this happens a day or two before you begin to develop symptoms, that the day before you become sick. For example, with flu, you may be fine on Tuesday, and then Wednesday you feel terrible. Tuesday you are able to transmit the illness to others. And that's what we're seeing with coronavirus as well. However, we're also seeing individuals who continue to be without symptoms, who don't ever feel sick, but yet are infected and able to transmit to others. So this is a particular challenge, and this is one reason why we are having this universal masking approach in our community. That mask is not necessarily to protect me from you. It's really more to protect you from me, because I might be one of those that is asymptomatic and able to transmit. So many people think, great, if I wear a mask, I'll be safe, when in reality, we want people to wear a mask also because you may be the one that's sick. Now, if we are telling people, make sure that you don't come to work if you're sick, or that if you have a fever, then we oftentimes have to think about, how do people know that? How do they know when they have a fever? Do they own a thermometer? Now, in my practice, I will talk with patients about fever, and I'll have many that will say, I don't know whether I have a fever or not. Can you check my temperature? But yet we know that for the vast majority of us, if we have a healthy immune system, we know when we have a fever. We know when we don't feel well. But people may be very concerned about having a fever because of all of the publicity that we have about this illness, and they just may not trust themselves. So if you are asking your healthcare worker or your employees about their health before they come in, if you're asking if they have a fever, then give them some way to make that determination. Perhaps a digital thermometer. It may be a couple of dollars for you, but it may be quite helpful for your workforce. Make sure that they know how to access healthcare if they need it. Who do they call if they become sick? We know that we have a significant number of our workforce that does not have any health insurance coverage. Either they haven't sought it, or they are in that gap where they cannot afford it. So make sure that they know where to access healthcare, because if they're sick and you tell them to stay home and go see their primary care provider, many of them may say, well, I don't know who that is or where to go. So help them then make some of those determinations. Make sure they have access to a mask or some type of face covering. That now is our approach as we reopen our community. So they should have access to that, and if they are able to wear it not only while at work, but as they leave and are around in the community, then that can be quite helpful. Make sure that when they're at work, they know when they're supposed to wear it and when they're supposed to clean it or dispose of it. If they are wearing a cloth mask that is their own personal mask, then you need to make a determination about how often you as the employer want that to be clean. So you may say things like, whenever it looks dirty, or make sure that you wash it at least twice a week or 3 times a week. You make that determination and give them some information. Make sure that they have a place to keep their hands clean. If you don't have access to a sink, then the alcohol-based hand rubs are excellent. Make sure that you have a way to keep the environment clean. The environmental disinfectants that we commonly use are very effective against the coronavirus. So make sure that you have a disinfectant available. If you provide tissue or have tissue in your workplace, and I strongly encourage that, because we want people, if they have to blow their nose, we want them to be able to have ready access to a tissue. Make sure that there's a garbage can that they can throw it into that's readily available. And then make sure that they know how to deal with a customer who may come into the business who appears to be ill. So all of that information is going to be quite helpful for you as you have discussions with your workers in returning to work. So now I want to just take a few minutes and go through some scenarios that may be relevant for you. And then we can talk about how ways to address this. So Sarah works in your business, and she calls in today sick. She says that yesterday she started to have a sore throat. She noticed it after she was leaving work, and then began to feel worse all throughout the evening and the night. This morning as she gets up, she thinks she has a fever, and she's calling to ask what she should do. And while you're thinking about that, then you begin to wonder, what should you do? So first, what should Sarah do? Well, first, if she is ill, if she has a fever, if she feels ill, she should stay home and call her primary care provider. And her primary care provider then can talk with her about what her symptoms are and then help make the determination if this is something that sounds like COVID-19 or something else. They can work with her. If she doesn't have one, then I would encourage her still to stay home. And if she continues to feel badly and is concerned about whether or not she's getting worse, then she should seek care at an urgent care or emergency department. And we always encourage people to call ahead and let them know that I don't feel well, these are my symptoms, because that facility then may say, well, okay, you're going to need to come in this door, or when you come in, you can't enter without a mask, or they may have then some instructions that would be important for her to have. So the notion here for you as the employer is when you have a healthcare, or when you have a person that calls in sick to work, you want to see what information you can get from them, and because that information may be important to you, but we don't want to encourage a worker to come to work sick. If so, this is how you may then set up transmission within your business. Now, this is not only challenging now, but as we deal and have people thinking more about seasonal allergies. We'll have people that'll have seasonal allergies where they may feel badly, they may have a runny nose, they may have a cough or a sore throat just from that nasal drainage. And so they may be concerned that, what they have is not their allergies. So we really have to encourage people to think about, what's your baseline health? And does this feel worse or different? If so, then give them some ideas on what to do. If they may be able to come to work, then give them that information. If they have symptoms that are concerning either for them or for you, then think about what that alternative is. All right. Now, you should tell her, of course, to stay home. You should have a mechanism at your place of business to see if anybody else is also sick. So having some sort of way to keep your finger on the pulse of the health of your workers. Now, many people may push back or feeling like somebody is watching over them or meddling in their business. And so we recommend that you take an approach that you don't necessarily care if someone has, they need the day off to go somewhere with their child. But what you want to know is if they have any illnesses, any respiratory illness, any GI illness like diarrhea or vomiting, if they have a fever, we don't want them to come to work with those symptoms. So making sure, they may not want to tell you exactly why they aren't there, but if you can try to rule out, are you not coming to work because of any of these, then that helps you keep an eye on what is going on with the rest of your workforce. If you have had someone that has been exposed to another individual, and you may find this out, as our community opens back up, we know that we're going to move from the about 2% of our population that has been ill with coronavirus to probably more in the neighborhood of 5 or 10%. So that's going to be a lot more people. When we have a lot more people, that's a lot more opportunity for exposure to occur and transmission to occur. So you may have someone that comes to work that says they were exposed to somebody, they don't feel badly. Just because they were exposed does not mean they need to stay at home. If they have been exposed to someone, they can continue to work unless they begin to have symptoms. And at that point, they need to be at home. They would need to wear a mask or some type of face covering if they have been exposed, but that should be our routine now. So we wouldn't have them do anything differently. So again, trying to contain those particles. All right, and if you have questions or if something comes up about any of these scenarios, please don't hesitate to stop me, and we can answer questions or address them either at that point, or I'll have a couple of minutes at the end. All right, here's another one. Jean calls to tell you that her roommate's sick and has been diagnosed with COVID-19, and she asks you, should she come to work? So again, the idea is if she has been exposed but is without symptoms, Jean can return to work, and we would want her to continue to, again, wear a mask when she returns or some type of face covering. If she does not have symptoms, then we do not consider, although we know she could be infectious, any of us could be infectious and without symptoms, but our approach is if you are ill, stay home. If you are not ill, then you can come to work. All right, John was diagnosed with COVID-19, and it's been, a few days ago. He's feeling better and he needs to work. And so he's calling you to ask you, when can he come back after he has been off? So I think this picture kind of helps describe the approach. And the Kentucky Department for Public Health put together a very nice summary of returning to work that was focused primarily on healthcare workers. But it's useful for any of us to kind of realize, having a process in place, it makes it a lot easier for us to figure out and communicate with our workers. So the idea is once you have been diagnosed with COVID-19, you can return to work under two conditions. Number one, you have to have at least 3 days. The last 3 days have to be without symptoms. And this means no fever, and you're not taking any medicine to reduce your fever. That your cough or your upper respiratory symptoms or your diarrhea have been gone for 3 days. And it's been at least 10 days since the onset of your symptoms. So in this graphic, if someone had symptoms for 7 days, and they would then have to have 3 more days without symptoms, so that would be their total of 10 days. And then when they return to work, we'll want them to abide by what our community now is saying is important, and that is a mask or respiratory protection, some type of face covering when you come back to work. Now, in this same situation, what if that employee was sick for 12 days? Well, they would be off for 12 days plus another 3 days without symptoms. So that individual would have to be off then for 15 days. So the idea is to know, when did symptoms start? When did they first feel sick? And then when do they feel like they're better? And then how many of those better days have been without symptoms? You need to be without fever for 3 days, at least 3 days. So sometimes putting a little chart or something like this up, some kind of graphic, may help people understand. Otherwise, you can get lost in kind of counting days off and so forth whenever your employees are off and want to come back. All right, here's a frequent question that I get, and this is about antibody testing. So Kelly had an antibody test done at her church, and when the person that did that test gave her the results, she wasn't sure she understood what they were saying, but she thinks that she is immune. So what does that mean? So does it mean that she needs to wear her face cloth at work? What if she's been around a coworker who's ill? What does that antibody test mean? And this is very important because every day I get multiple calls and requests with questions about antibody tests. So I'm going to give you and this is an evolving situation. Right now, just in a nutshell, our antibody tests are not reliable. That some of the most recent data have said that your antibody test, if you are in a public setting and your antibody test is done at one of these types of events, it's probably right 50% of the time. Well, you can just flip a coin for that and tell you, and will be just as likely to be right. So we don't want people relying on those finger stick antibody tests at this point because they simply are not reliable. And we don't want somebody making decisions that may impact their community. So as a reminder, a positive test doesn't mean that you are protected from future COVID-19 infection. And it does not definitively indicate that you ever been exposed and infected with COVID-19. This is why we don't trust the tests, because they are not consistent in what they tell us. Also, just because you have a negative test, it doesn't necessarily mean that you haven't had prior or even currently infected with COVID-19. So in other words, it's very difficult to rely on the existing types of immunity tests that we currently have. Now, I'll say there is a difference for some tests that are done in the hospital setting because a different methodology is done. There, instead of having a finger stick, you'll have blood drawn. You've got a big tube of blood, and you can spin it and concentrate those antibodies and then get a much better idea of the true results. And the testing process is different. But the finger stick antibody tests are just not where we need them to be. And we have a number of tests that have not been reviewed by the FDA, the Food and Drug Administration. And even some of those that had, the review wasn't all that good. So we are concerned about people using those tests and making some type of a judgment, thinking that I can determine if I'm immune or not immune, or if I've had the disease or not. So the points to remember about our current antibody tests: also, once we have an infection, we begin to develop antibodies against whatever that type of infection was. The problem is we can develop antibodies, but the antibodies don't protect us. So for example, if I have a patient with HIV disease and I draw blood, the positive test tells me that that person has positive antibodies to HIV. Well, clearly that person is infected, so those antibodies don't give me the information that I need. So the antibodies for a patient with HIV infection don't protect them, yet they'll have a positive antibody test. We also know that sometimes we will have antibodies that develop, but we don't have enough of them. We may have some levels of antibodies, but they're not enough to protect us, or they might not last very long. So a good example of that is the antibodies that we develop after flu, that we know that we can become sick with influenza, but that doesn't mean that we cannot become sick again with the same type of influenza later in that season, that the antibodies may not last that long. And that's why, again, we have to get a flu shot every year. We also don't know if the antibodies will be effective if the virus changes. And we're already seeing a little bit of data that this coronavirus is very clever, and it's also ferocious. That we are seeing that it is learning and adapting and beginning to make a few changes. This means that some of the antibodies we develop may not be the type that we have to protect us against infection with this changing coronavirus. So the bottom line is there's still not enough of information that for us to know about immunity and how we develop the antibody tests and how well we can rely on them. And we have specific statements now from the CDC and the Infectious Diseases Society of America and the World Health Organization that's telling us that these antibody tests, these rapid antibody tests, should not be used to make individual health decisions. We may be able to use them to have some idea about what is happening in our community, but we should not be using them individually. So please don't suggest that your employees go out to have an antibody test to tell whether or not they have had this illness. It may not give them the right information, and they may take action that subsequently causes harm to others. Now, another question that I get often is, where are we with vaccines? So we know that at the present time, there are about 30 different types of vaccines that are under study right now. and there are different phases of study. Even under the best of circumstances, and my boss always reminds me, Ruth, remember the entire world right now is working on COVID-19. We've never had a health issue that everybody in the entire science world is focusing on COVID-19. So there are a lot of resources that are going into vaccine development. But even if we have a vaccine that looks like it works, it still has to be studied to make sure that it is safe, and it still has to be studied to make sure that it is actually effective. And so we expect that we will not have a vaccine until next year. So that means this year we're going to have to be dealing with both flu and COVID-19. If there is some magic breakthrough with a vaccine, that we know that this will be incredibly sought after by the general population, and there will be multiple strategies to try to make the vaccine available. Everything from, I'm sure we'll have drive-through clinics allowing vaccination and vaccine literally available everywhere to try to get it into as many people as possible. Probably it will still be a shot that'll still go likely in the muscle in your arm, but I don't think any of us would feel too badly about that. I know I certainly wouldn't. If there's a vaccine and it looks like it's effective, then certainly I'll be one of those in line. One thing that you can do, though, to help your employees is to make sure that they know that a flu shot is also going to be important. And the reason for that is that when you have flu, your health declines somewhat. It takes you a while to get back to normal. And during that period of time when you're not back to normal, you are more susceptible to not only other infections, but you are more susceptible to the bad things that happen with that infection. So if I have had influenza, and in my recovery phase, I become now infected with COVID-19, and I have that co-infection, I know I am much more likely to have bad health outcomes from either one or both of those infections. So if we can get our workers to have a flu shot, that can not only help keep them from becoming sick due to influenza, but it can also help then these really bad outcomes in the event they become infected with COVID-19. Because as I said last time we spoke, please remember that this is a disease that we don't have immunity against, we don't have a vaccine, and we really don't even have very good treatment at this point. So we have to assume that many of us will become sick. Now, if we look at many of the projections that talk about the number of individuals or the percent of individuals in our community that need to be ill before we have that, quote, herd immunity, it's about 70%. So that means we would need to have about 70% of our city population. So we've got about 750,000 in our community. So that means we would have to have somewhere around 50,000 or close to 500,000 of our 750,000 to become sick. That's a lot of people to become ill. So our job in reopening business is to make sure that all of this illness does not happen at the same time. Certainly, we're going to see illness. There isn't really much of a way around that until we have a vaccine. So we are going to see illness. And our choices are that we continue to stay confined in our house, or if we begin to get back to whatever our new sense of normal will be, and then watch the amount of illness that is occurring in the hospitals, and then use that as our marker for when do we need to begin to maybe shut down again. So if we see that hospitals are filling up and ventilators are being used, then it would be time for our community to say, okay, wait a minute, everybody needs to go back. We need to shut down again. We might be shut down for 2 weeks, maybe 3 weeks. Until then, the amount of illness returns back to a more manageable level. So as you return, you will also need to realize that this is not an absolute opening that may not have a speed bump along the way. So you may have to have the opportunity to close back down again for a short period of time before again opening back up. So your employees need to understand that as well. Again, we're learning about this illness. It's hard to imagine that it's only been about 5 months that we have been trying to deal with this. We didn't even know that there was a problem. I told friends I was actually in Wuhan in November of last year, and there was no mention of this illness. You didn't know anything was going on. Hadn't even come to anybody's awareness yet. And it wasn't until December that we began to get the information from China. So I know it seems like it's been a lifetime ago, but it's really only been about 5 months. So as I close and before I take some questions, I think some things for you to remember to do is to make sure that you're having discussions with your employees about illness as soon as possible. Make sure that you've got policies or guidance that are very clear, that they're written very, very clearly, and even you just do some checks to make sure with them that they understand it. Know how to reach your local public health office and officials, somebody that can help you answer questions and make sure that they are aware of what is happening in your business. Make sure that you have some type of medical professional that you can call and ask questions of. They may be able to provide you with information or may be able to help you with decision making. Remember also that there's a lot of fear and stress that are going to be present. People are just not acting like themselves. And so recognize that. And so individuals who have trouble coping or dealing with the stress, it may be more pronounced now than it has been in the past. So recognize that and then do what you can then to help people be able to deal with something that is largely out of people's control. And then as you consider the infectious side of COVID-19, also remember the non-infectious sides of this disease, that we are dealing with a number of personal issues. We're dealing with that whole concept of mind, body, and spirit, that mental health issues. And I don't mean psychosis or a diagnosed mental health condition. I mean, people are stressed incredibly. I'm sure you are too. Realize that you may have people that just don't act like themselves and maybe act abnormally. This may be part of how people are dealing with this. We don't know what goes on behind the closed doors of any of our employees, but everybody is struggling at this point, and realize that. And then realize then that, spirituality is very important to many employees, and keep that in mind with them, that people will use a variety of means to cope with our new normal. And I'll close then and turn this back over to Sarah, and I'll be glad to take any questions that you might have.
Thank you, Dr. Carrico. That was very, very interesting and fascinating. To your point about fear and stress, we often say that we should judge other people by ideals and don't judge us except by actions. So, I think that we all have to keep that in mind and grant a little grace to people. So thank you for pointing that out.
Yes.
A few questions that have come through. You talked about the antibody test not really being effective. What has the data shown regarding those originally infected and how long their immunity lasts after recovery?
We really don't know. Right now, we don't even know if the antibodies that people have developed are protective. We originally thought that, like most infectious diseases, you will develop antibodies that will keep you from becoming sick again. But we recently received information from Korea that was showing individuals that had prior positive tests were now becoming ill again. Well, the first thing that we question is, was that first test result accurate? Then was the second test result accurate? So we still have many questions about how people are being tested. But we know right now, if you are sick, the test that you should have is a nasal pharyngeal swab, not a swab in your mouth, not a swab just in your nose. It is a swab that actually is back into the back of your nose. And if I do that to my patients, I make them cry and gag, and they hate me for a few minutes. But if I'm going to give you a test result, I want it to be the right test to give you the best results. It's not the most comfortable. So I can tell you, well, how about if you just put that swab just right inside your nose? Maybe it'll be right, maybe it won't. I don't think any of us are going to want to pick something that does not have a high degree of reliability, especially if you're going to make a decision about that. Now, we know that we've got a number of research studies that are going on that are looking at and trying to discover, and this is really the benefit of having the individuals that are expert in looking at what is in your blood, looking at what is going on with your immune system, and trying to figure out, do you have the types of antibodies that will provide you with not only temporary protection, but are they the type of antibodies that can provide you with a longer lasting infection? So this is really the benefit of science. And so it's kind of the nice thing for having a university in your community where individuals that have this interest and this expertise can look at that and then help us answer some of those questions. So again, I'll kind of go back, Sarah, that we've only been dealing with this pandemic for 5 months. I know it seems like much, much longer, and we have learned a tremendous amount, but I have to say, every day I learn something new that is a change from what I learned the day before or the week before. The amount of knowledge that we're gaining is absolutely tremendous. So I know that we're going to be able to get ahead of this. I don't know when that will be, but I know that the way to get ahead of this is to, again, rely on the use of science to help us drive decision making. And then from a community awareness perspective, realize that there's going to be some tough times that we will be dealing with together, because there is no way at present that we will be able to prevent illness. Our best bet is to try to control the amount of illness that occurs so someone doesn't go to the hospital and is unable to receive care simply because we have too much COVID-19 disease and that disease is taking up all of the resources. So our community leaders in public health and others are trying very hard to find that balance. And it's going to be challenging for all of us, but I'm confident that when we work together, that just like other times when we have worked together to address challenges, that we will be successful.
Very, very good point. It's wonderful to have the university here and able to provide that expertise. Have you been in contact with the governor's office on a frequent basis regarding your recommendations, recognizing that public officials are trying to get to that fine balance, but have you had that dialogue with elected officials about the science?
Yeah, so there are many individuals at the university that will have a variety of pieces of expertise in the area, and each of us has our own area of specialty. So my area is in infection prevention and control, and the infectious diseases side of this. And so we certainly have the ear of the public officials and will share information, and it becomes then their job to figure out how do they put it all together and get all those pieces so that they make sense. But yes, and I think a number of individuals at the university, and we have, of course, some excellent leadership that are helping to make sure that that our voices are heard, because we realize that Louisville continues to be if not the economic engine for the state, one of the largest and most powerful economic engines. And so certainly what happens here is of critical importance to the state.
Excellent. I do see another question that has come through. You mentioned a lot of recommendations at the beginning. Would you recommend writing those down or making them the practice at every business? Well, what do you think there?
I think if you expect, and I've learned a lot of this from my engineering colleagues, that if you make instructions and information not only available, but if it makes sense, then it can help then guide people to do what needs to be done. So it's a lot better to have something in writing and have it visually presented in a way that is very easy to decipher. So for example, it's much easier for me to explain when somebody comes back to work if I use that graphic than if I tell them, okay, it has to be a total of 10 days at least, the last 3 have to be without symptoms, then somewhere along that line I may lose them. I'll see kind of that shade come down over their eyes. But if I can give them something in writing, give them a graphic, then that helps. And I know also within our businesses, we're going to have the full range of literacy, health literacy, just the basic understanding of information. And we have a number of people in our community that English is not their primary language. So I think it's always safe to have something in writing. And again, have that read by somebody else other than you. I know if I write something, I think, oh, it's perfect. I've done an excellent job. Then I'll give it to somebody else to double check me, and then they will find the mistakes, or they'll find areas where it's not as clear as I thought it was. So that whole idea of, two heads are often better than one. And so get somebody to help with you. So I think these are great things to work on through GLI and other such work groups to help craft some of these very simple documents that can be used across businesses. And I think, other groups like I was speaking with a group from the Kentucky Health Collaborative yesterday about the number of tools and resources that they have on their website. So I think groups such as GLI and maybe working with the collaborative can help them bring that sense of robust types of tools and resources that everyone, I think, would appreciate.
Excellent. I know a lot of colleges have changed their policies for the fall. Have you made a recommendation to U of L to go ahead and make a decision on fall semester, or is that still in play?
Well, I think the university, of course, has leadership that is going to be very capable of making those decisions. And I know that there are a lot of questions about how do we make sure that students have the ability to return to campus. I mean, we certainly want students to be able to return to campus because we know learning and social interaction has to continue. As a university, I know, and again, I'm not on those committees, but there is a good bit of sharing of information. So I know that there's a lot of work in trying to craft these return to school strategies, so it not only focuses on the needs of the student, but also on the needs of the parent that is going to be sending their student back to the university, because there's that mutual expectation that we're going to do our best with each and every student so that their not only educational journey is a quality and a safe one, but their personal journey is as well. So I know that there's a lot of work going on now, and I know there's been information in the paper about how U of L is readying for the coming semester. So I have a lot of confidence that all of us will be ready, and we've got some excellent leadership that will help get the group in order and ready to rock and roll.
Excellent. Well, as you think about industries that are returning and reopening, is there anybody that's doing it really well? Is there a particular industry that's doing it really, really well?
I think that we have some great examples of best practice, and I've been speaking a lot recently with businesses that have a strong sense of infection control. So, for example, the airline industry. What are they doing to get ready? So there are groups that are responsible for environmental disinfection for public buildings and again, the airline industry and commercial buildings and so forth. And they're doing a fabulous job in trying to be very thoughtful about their approach and realizing that, there are very few things that are one size fits all. And I think our return to work approaches are going to have some things that are going to be beneficial across the board, and then some things that are going to largely work in one area but may not be appropriate for another. So I think just general environmental cleaning and disinfection in buildings is probably something that we can all relate to. Do we need to practice the same level of environmental disinfection everywhere? Probably not. We need to at least have a first tier that is everything is similar. But at this point, after that, it's going to be dependent upon the building configuration and what's going to happen inside the building and so forth. So I know several of these large companies that are dealing with getting some of these large commercial buildings and the airlines back to work are doing a fabulous job, and I think are really rolling out then this tiered approach with their employees and really trying to figure out, how do I get buy-in from my employees? How do I, get them not only to understand what we're doing, but to become personally vested in our success. And I think this is a challenge for all of us. But I think we can capitalize on the desire that most of us have to not be sick again, or not be sick in the first place. And then that kind of gains our attention, and then helps it be much more of a community and a collaborative approach.
And to your point about being out there in the world and getting infected, and the data that we have on where it's coming from, what about some of the public places that we're going, and the bus rides, or the grocery stores, the restaurants that are going to be reopening? To this point on contract tracing, do we really know where people are catching it?
Well, we really don't yet. That there's some, and this is really the basis for epidemiologic, or these large community studies. Now, one of our biggest challenges has been that we just simply have not had testing capacity. And our focus, and my focus has been on, we need to make sure the healthcare infrastructure is solid, and that the healthcare infrastructure is able to address illness in the community. So if we don't have nurses, if we don't have physicians that are capable of going to work, then everything within a society falls apart. There was an interesting article in the New England Journal of Medicine today that said exactly what we have been saying, kind of the drum we have been beating now, for the last several months, that when you don't have enough tests, you've got to decide where to use them. It's sort of like that story about Willie Sutton, the bank robber. And people said, "Willie, why did you rob the bank?" And he said, "Well, that's where the money is." And that's true. So we need to know where is the illness, and that's where we are testing to see what's the scope, what are the risk factors, and so forth. Now we are seeing a lot more testing capacity being available within the community, and then that may change our approach, what we look at, but we still have to be very smart about what we're doing, and we have to communicate with the community, and we have to also be able to let people know that I know that everybody would like to be tested, but at the present time we don't have that capability, and that we don't want people that don't need to be tested to use the resources that are still somewhat rare. So we have to make sure that we've got not only good leadership in making those decisions, but that we're communicating effectively so people know why we're doing what we're doing, or why we are suggesting. So I think that we will learn more about that, exactly where there are particular cases of, or clusters of illness, our contact tracing, that I know the health department, our public health is gearing up to do more of that. After we have more testing in place, then we'll know who do we need to test around and what do we need to know about. But in the meantime, we still know that there are some very basic answers that we have. We know that this is a disease that is transmitted via the respiratory route. Everybody breathes, so that means everybody is at risk. We know that when I cough or when I sneeze, I contaminate the environment. If you touch the environment and then touch your face or rub your eyes, you then can become ill yourself. So we know these very basic things, and what we keep hearing, not only from our mayor, but from Dr. Moyer with the health department, from our governor and others, that will keep telling us, when you're sick, stay home. Keep your hands clean. Cough into your elbow, your sleeve, not into your hands. Keep your environmental surfaces clean. Those very basic things, all the things our mom told us when we were little. It turns out mom was right. Those very things are important now in our response to this pandemic.
And you mentioned testing capacity. The last time we talked, you were saying that you really needed more money in order to execute the research that you were doing. Where does that stand? Have you been able to secure any dollars?
Well, I think that there is certainly more interest that is coming into the community and making this more available. Now, if you ask me, is there enough, are there enough resources to do research? I would have to say no, that there aren't, that there are so many questions that we have then that we feel like are valid questions to answer. So, if you have someone that is looking for something to do with their available resources, then I would say certainly give me a call, let me know, or contact then We have a leadership involved responsible for our research and innovation at the University of Louisville, and they can help then channel and try to find researchers that have areas of expertise that are interested in doing that. So if the question is, do we have enough? I'll say no. Do we have certainly beginning to receive research support? I would say yes, we are certainly doing that. It's our job then at the University of Louisville to make sure that those funds are going to the individuals that have the expertise to answer the questions at hand. And I know that we are all eager to do that, because at the end of the day, this is our community. So this is where I live, it's where my family lives, and so I'm interested in what happens in my community. And I think that I speak for the other researchers that we feel the same. We are heavily vested into what happens here because it's a time where it's all about us, right? Every one of us.
Well, we're lucky to have you guys so local. It's very comforting to have you as a presence. Wanted to just also talk about more of that long-term business outlook. We've been talking a lot lately about what do we do next month. And this disease has made even that hard to determine, much less the long-term impact and the long-term plan. So what would you say to businesses about making their long-term plans right now?
Well, I think that probably your number one strategy needs to be, how do I protect my workforce? And that means that whatever your plans are have to involve them so they understand that, you know, that your business stays open when you have a healthy workforce. So keeping them engaged. Secondly, I think that you need to maintain some level of agility, understanding that when we see more disease in the community, I have no doubt that if we begin to see more disease than the hospitals are able to manage, then our mayor, our governor will say it's time for us to kind of ratchet back. It's time for us to close the faucet, not be as socially engaged. And so every business is going to have to be able then to think about, how would I close down? What if I had to close down again for several weeks? How can I remain solvent? And so I think many of us have learned to do a lot with technology over the course of the last couple of months, things that we never thought we could do remotely. I think we're finding that we can. I think this will prompt us to see what more we can do. This is certainly an area where we are seeing a lot of business engagement and innovation to figure out how can we continue to act and work remotely. So continuing to look at that avenue, looking to see how you will and what do you need to have in place so that your business can shut down. How do you make sure your employees will be able to come to work and then return to work when you open back up? These are all going to be challenges that I think are not going to go away. And in fact, many of us feel like as we get to the fall, when we begin to see influenza, that's going to just cloud the picture. That's going to cloud the picture so much. And if it means that we also have increased severity of disease, then this also may be a prompter to have us begin to scale back. So what are the things we can do then to keep that from happening? We'll practice these good types of decisions and interactions, but also things like, you know, please get your workforce vaccinated against flu. This is going to be just critical. If you've got a lot of employees and you're trying to figure out how to vaccinate them, there are a number of places that you can reach out to. Certainly the health department, your local pharmacies, if you have a medical advisor or somebody, if somebody has a question, you know, we have a vaccine clinic at the university. We can certainly help and try to figure it out for you. But vaccination is going to look very different this fall than it has looked at last fall. I've had conversations with probably 15 different pharmaceutical companies that are all saying, wow, we've got to do drive-through vaccination this fall. And I'm like, absolutely, you will have to. You will not be able to bring people into congregate settings for immunization. Not only are people not going to want to go there, but they may not be allowed to go there if we have restrictions. So I think if we've never been flexible before, you're going to have to be flexible now because we will continue to figure this out together. And but everybody is motivated to do the same thing. We all want businesses to be open. This is how our community stays solvent. We all need to be social, the social animals that we are. So we want the same things. We just have to figure out how to get there safely.
Well said. Very well said. Thank you. This has been a very informative presentation. Lots of good questions answered. So thank you so much for Dr. Carrico
I'm
for
happy
joining
to.
us today.
Thanks a lot. I appreciate it. Thank you all for staying open and being open and helping to take care of us. And I'm going to be especially happy when I can go get a haircut. So that's going to be the highlight of my life, I can tell you.
I think a lot of us will. Well,
Thanks
as
very
I said
much.
earlier, you will all be receiving a survey. Please fill that out. You can access this recording on our website. We are trying to support you during this critical time. If you have ideas for webinars that you would like to hear about certain topics, let us know. We do have another webinar coming up on May 19th. It's called Caffeine and Quarantine. These caffeine and quarantine sessions have been very well attended, lots of great discussion on there. So thank you all again for joining us. Stay safe and be well. Bye.